Who hasn't heard of Ozempic or semaglutide? It's everywhere from headlines to social media, and with really good reason. It's one of the first few medications that's really changed how we treat both type 2 diabetes and obesity, not to mention its positive effects on many other comorbidities. But semaglutide is just the tip of the iceberg. There's a whole new wave of medications coming, and they're working in many ways we've never imagined before. So let's just start with the OG semaglutide. Semaglutide is a GLP-1 glucagon-like peptide 1 receptor agonist, which means that it binds to and activates to GLP-1 receptors and mimics the effects of its natural hormone. So first, it boosts insulin secretion, reduces glucagon release, lowers blood sugar, improves glucose tolerance, it slows down gastric emptying, which means that food stays in your stomach longer and makes you feel fuller sooner and for longer. It also acts on the brain and reduces appetite and curbs food cravings. The result is better blood sugar control, improves satiety, and of course, for many people, it comes with significant weight loss. And next we have Mounjaro or tirzepatide. So this drug activates not only GLP-1 but also GIP, glucose-dependent insulinotropic polypeptide, in a dual mechanism pathway. In many ways, GIP works complementary to GLP-1. So like GLP-1, GIP increases insulin secretion after meals to lower blood sugar levels, it reduces appetite, slows down gastric emptying. On top of that, it also improves insulin sensitivity, which means that the body can use insulin more effectively. It also helps your body store fat more efficiently, which means that it pushes fat into storage areas like fat cells and prevents it from building up in the wrong places like the liver. And when you combine both these pathways in one medication, you'll get amplified results on blood sugar, satiety, and weight. And if that's not enough, we have a new kid on the block. Its name is retatrutide. So this drug is still in clinical trials, but it targets 3 receptors: GLP-1, GIP, and glucagon. And what's glucagon? So glucagon is a hormone that normally raises your blood sugar by telling the liver to release stored glucose. But when activated in the right way, the glucagon receptor can actually increase energy expenditure and lipolysis, while also decreasing lipogenesis, fat formation, and promoting insulin secretion. So this means that it breaks down fat, reduces how much new fat your body stores, and may even help to preserve muscle mass. All while the GLP and the GIP components are helping with appetite control and glucose regulation. As a pharmacist, I think this is one of the most exciting developments in the field because these medications really reflect a deep understanding about how our metabolism works when it comes to weight maintenance, and weight loss. And retatrutide is currently now in phase 3 clinical trials. Honestly, can't wait to see what happens next.